Hey, Ricardo, thank you for coming in. You have this marvelous background of contribution across many dimensions, especially particularly in healthcare. You worked in Parliament, of course, and you worked as a physician as well. You're part of the COVID emergency. You even worked in the COVID emergency rooms and things like that. I mean, you've been everywhere, including working with parliamentarians and on this network for global health. So I appreciate you coming in and sharing your insights with my audience.
Well, thanks for having me, Stephen. It's a real pleasure. And thank you also for your leadership in the field.
So, you have this marvelous history of contribution and success. And what were the inflection points that made this wonderful career that you have and the impact, really making you very sort of conscious of making a substantial contribution to the world in some way? And it could have been something when you were 3 or 5 inside the family, outside the family, something at school, mentors you have. Are there, what are those 3 magic moments in your life that created this wonderful career that you have?
Well, I was very fortunate to grow up in a home where both my parents, they were refugees from Angola. And because of that, they had to start a new life in Canada, where I was born and raised. And the resilience and willingness to understand that they had to work to make it into life is something that has always kept with me. And growing up in Canada, I was very fortunate also because of the education system really pushed me in the direction of understanding public service and the power of volunteering and of being part of the community. And truly, it was at a very young age, around 8 or 9, that I became very passionate with public policy. And it was after a school visit to the provincial parliament of Ontario that I truly understood what it meant to be a politician and to be elected into office. And I found it fascinating, this idea that people would choose other people to represent their interests for the benefit of the community. So at a very young age, I would say that was very transformative in terms of my public policy perspective. On healthcare, it was also around 6 or 7 that I read a book, which was a children's book, but about the story of Louis Pasteur and how he discovered the rabies vaccine. And that was clearly the starting point of my admiration for medicine, for life sciences, for the fascination of science in general. And and then throughout my career, that just has been reinforced. I would say my last moment that was transformational was much later, when I chose my specialty after med school and I went into infectious diseases. And, for a few years working in that field as a physician and working mainly with HIV patients, TB, viral hepatitis, a lot of tropical diseases also. And it was transformational in the sense that it opened up my eyes to how many parts of society are somehow forgotten by the rest of us, how people live in such marginalized and vulnerable conditions that then that leads to situations that leads to poorer health. And that really made me rethink the way of the power of determinants of health and made me very passionate. And that has led me to all of my work in policy, and even my work in digital has always been driven by this idea that we need to make sure that we don't leave anyone behind.
I mean, that's really fascinating. I mean, I can see how when you were very young and being in Canada and, being moved by what's happening in Canada, but also the education system and then your ability to see the public aspect of it and the intersection of that. And then, of course, all the other work that you've done and how that helped to shape you. So but you also went back to Portugal, right? And served within the parliament. I mean, how did that migration occur from Canadian education and background to, becoming a member of parliament in Portugal?
Yeah, so when I was in my early teens, my parents decided to move to Portugal because they wanted us to be closer to the extended family. So I grew up, in my teens, and then I did med school in Lisbon. And halfway through med school, I felt once again the calling for public service. And so I decided to try to understand what was the party affiliation that I felt that I would fit into. And I applied to the youth of the Social Democratic Party in Portugal. And so that was parallel to my medical work for many years. But then in 2011, there was a snap election in my country. And, it was a tremendous financial crisis, the IMF, or European Bank bailout of Portugal. And the party leader at the time invited me to run for the party for parliament. And I decided to take on that challenge at such a demanding time for the country. And I was elected in 2011. And then I ended up serving 4 terms with a particular focus, of course, on health policy, but also on foreign affairs. Yeah, and in between those 4 terms, I also served as a deputy mayor in the town where I grew up, in the city of Cascais. And so it was quite a fascinating experience. And when I did that, as you can imagine, it was very difficult to keep up with my work as a physician. So that's when I transitioned more into my academic work, where I started gradually to focus more on global health and on digital.
So, you were a practicing physician for 7 years. Did that occur before the parliamentary work or after the parliamentary work? And then you did a 5-year infectious disease residency and an internship at the WHO. So that must have occurred before the parliamentary work. And then, of course, you were involved in the COVID pandemic. You volunteered as a medical doctor in the hospital, in the emergency room, and so on. So that would be post parliamentary, right? I'm just trying to get the chronological.
Getting your timeline right. Well, yes. So my work as a medical doctor and as a resident was prior to being elected into parliament. When I was elected into parliament, I had to make the very difficult decision of stepping down as a practicing physician, only for friends and family, so to say. And back in 2020, when the pandemic hit, I felt I was I believe the only person with any training in infectious diseases with a seat at the parliament. And so I felt I had a very important role to play on the policy front, but I also felt the obligation of being with my colleagues in the hospital. So I went to my local hospital and I volunteered. And so on the weekends, I would work in the COVID emergency room, going back basically 8 or 9 years after stopping being a practicing physician to support my colleagues. And I did that for about 1.5 years. So that was the time I went back to being a practicing physician, along with keeping my work in Parliament in such a challenging time. The last time I put back the gloves on, so to say, and went back into the field was the first summer of the Ukraine war, after the Russian forces invaded Ukraine. And that's when I offered to volunteer as a medical doctor to the regional hospital of Lviv during my summer recess from Parliament in summer of 2022. So it's been, those typically now, as a practicing physician, I go back as a volunteer when I feel I can be useful, and of course, when life allows me.
So you've been integrated into the focus group AI for Health in some way, right? Which is part of the AI for Good. So AI for Good, the preliminary work for AI for Good, which the ITU hosted for a number of years and it continues to do so, was in 2016. So that was kind of like the buildup. And then the first summit was in June of 2017, and then subsequently in May, and so on. There's been these subsequent summits, and then with COVID paused. But also in 2018, they formed this thing called the Focus Group AI for Health. Did you start getting involved with that program, or because you've been participating in some way, right, with that program?
So on the policy front and academic front, I've been involved in the field for several years. But specifically with the focus group, it was when I stepped down from Parliament in May 2023 to take on the role as CEO at HealthAI, the Global Agency for Responsible AI in Health, that I actually was invited to participate in that focus group, which has actually now evolved to become the Global Initiative on AI for Health, now co-led by 3 UN agencies: WHO, the World Health Organization; ITU, the International Telecommunications Union; and WIPO, the World Intellectual Property Organization. And at the first official meeting we had in Riyadh HealthAI was actually appointed to be co-chair of the Regulatory Affairs Working Group within that global initiative on AI for health. So we've been working very closely along with the chair of this initiative, Thomas Wiegand, along with several other colleagues, including from WHO, Alain Lebrique, of course, who's the head of digital and innovation, who sits at HealthAI's board, and Samir, who leads his AI efforts, and all of the other people that have been very much engaged. And we're very much looking forward to, in a few weeks, actually, to host in Geneva, to be part of the AI for Good Summit, which ITU will be hosting.
So are you still meeting sort of regularly with this global initiative for healthcare?
So this global initiative is now going through a process where there's a finalization of the bureaucratic typical thing of the UN agencies. So they're finalizing a memorandum of understanding among the three agencies, which now has reached its final stage. We've been having informal gatherings among different members, and we're very much looking forward after the AI for Good Summit to go back into full work mode. And from our side as HealthAI, we just launched 3 weeks ago in The Economist, a full page where we were launching our community of practice and inviting people to join the community of practice. And we're hoping that by bringing together different institutions, be it technology companies, academia, governments, regulators, patient organizations, civil society movements, we'll be able to bring in all of that knowledge and that kind of leadership that we are conveying through the community of practice towards the Regulatory Affairs Working Group in the global initiative. And we're hoping to do our part as co-chairs there.
So if you can summarize then sort of your current activities, you have the HealthAI initiative, you have the Unite initiative, which is the Parliamentarians Network for Global Health. You're also having a significant role with this global initiative now for healthcare, which you mentioned is this joint program between 3 UN agencies, the ITU, because of the standards aspect of it, the World Health Organization, because they're sort of the de facto kind of body for healthcare, and then the World IP Organization, because there's some intellectual property aspects to innovation that's happening, right? So can you talk more about your initiatives that you personally have founded and you're currently heading up as well?
Yeah, sure. So on a personal note, my day job, as I say, is as CEO at HealthAI. But while running the global initiative, while running the global agency for responsible AI in health, our main role is to help provide what we position ourselves as an implementing partner for WHO and other international bodies, but also for governments. So basically, we do not define the standards. We leave that to the international standard-setting organizations, nor do we validate tools. We believe that should be done by national and regional regulators. What we do is we provide the technical assistance to help build that regulatory capacity, and we certify the regulators, if you will. So we certify the validators. And by certifying the regulators, we will be connecting them into one global regulatory network to facilitate not only knowledge sharing, but also to put together what we call an early warning system, which will allow countries to be able to know when there's an AI tool that has the potential to cause harm as soon as possible, so that safety brakes can be put in place, and so that working with technology companies, we can fix the technological glitches before it has harm on society and on citizens in general. So that's, I would say, the focus that we have at HealthAI, where we're also working on a repository of AI solutions, which is fed by the regulators. So as the regulators start validating tools, it will go onto this global repository. My other hat, as you mentioned, is my volunteer work as chair of the board of Unite, a parliamentarians network for global health. So I founded Unite in 2017, and I sit with several current and former members of parliaments, congresses, and senates on that board. So today we're present in more than 110 countries. We're nearly 500 parliamentarians in that network, also working with WHO towards promoting science-based, data-driven policymaking for health around the world. And on the academic front, I have two non-executive roles. So I'm the chair of the Harvard Charité Global Health Policy Lab, a partnership between Harvard School of Public Health and the Center for Global Health at Charité in Berlin. And I chair the Center for Global Health at Nova University back in Lisbon, Portugal.
So in these different initiatives, for example, HealthAI, do you have funding from corporations or how is your funding managed?
Yeah. So HealthAI is a nonprofit agency based in Geneva, and our location is very much connected to the fact that when the organization was founded in 2019, from the start, we've had the institutional support from the World Health Organization, which is also based in Geneva. And that's why WHO has a formal seat on our board. But as a nonprofit, we do depend on external funding. The main sources of funding have been philanthropic organizations. We're very proud to be recipients of funding coming from organizations like the Botnar Foundation or the Wellcome Trust in the UK. But also we have several governmental sources of funding, which include governments like Canada, Norway, Finland, the UK, New Zealand, among others.
And are you tying then with some of the medical programs of corporations as well? For example, I'm just thinking of David Rhew, who's the chief medical officer of Microsoft, and they've had so much resources they've created, and they're trying to make it available for rural healthcare, almost like a population health. They definitely have initiatives on the generative AI side as well, or AI and the application of AI, and making sure it's trustworthy and fair and equitable. They have this consortium called TRAIN, which David has been sort of really backing heavily. And so have you been integrating with corporations like, or David Rhew and people like that from who's the chief medical officer of Microsoft?
Yes, we are strong believers that if we want to build a global regulatory ecosystem where, we don't want to force anyone down a certain path, but we want the world to gradually evolve towards having at least a minimum bar of harmonization when it comes to standards, because that will accelerate the adoption of technologies. And that's, I think, something very important to say. Creating a regulatory environment is precisely to accelerate innovation and to accelerate access to these technologies and also to build trust towards them. And that's what we're trying to do. And we know that is only possible with the private sector and the developers. And that's why we've proactively been speaking with a lot of the private sector. So you mentioned Microsoft. There are a lot of big players out there, Amazon, Google, and so forth. But then you also have a lot of other mid-sized companies that are also playing important role in the ecosystem. And all of them are invited to apply to our community of practice. And we are actively engaging with several of those entities to see how we can work together, precisely because standards and regulations, they're only useful if they're actually applicable in the real world. And to be applicable in the real world, you need a full ecosystem approach, which means that this cannot only be done by governments nor by WHO. It has to have full buy-in of society and of those developing the technology, like the companies that you mentioned.
It's interesting. I've been invited to be the global advisor for the World Innovation Technology Systems Alliance, and I'm judging in their inaugural World Cup, but they're the industry association of industry associations, so kind of almost like a federation. And each of their members are industry associations in different countries. So CTA, which runs the CES conference, which is a really big one in the US, they're the official member for US. NASSCOM out of India is the official member for India. And every country has this sort of representative. It sounds like having some kind of relationship with them would be useful to you in either HealthAI or your Unite program and others. I'm just kind of brainstorming with you because these interviews are unscripted. I'm also the Global Impact Advisory Board chair and founder of the Global Impact Advisory Board for YPO, which is a community of 35,000 CEOs. It's the largest CEO community. It's very private, but they have a whole impact movement. And I'm thinking what you're doing would be, very sort of synchronous, or there would be a lot of synchronicity between what you do and some of the impact work they're doing. And then some of the academic associations like ACM or IEEE and others, IFIP, they're academic, but they also have large industry components to them. And I think they would be good ones for potential exploration of partnerships. Have you talked to any of these at all, or not? Or?
Yeah, I mean, just last week, our chief scientist, I know, was engaging with IEEE, for example, and any other partnerships and collaborations. That's what we're about. We're about bringing together different institutions and different key stakeholders that can help us think through what this ecosystem should look like. I think that the fact that we're ahead of the curve in the sense that many of the standards have not yet been developed is actually an advantage, in the sense that normally we have to retrofit from the standards that are out there to adapt to our institutions, to our governments, to our regulators. Here we are actually proactively bringing together the different stakeholders so that we can discuss what those standards should look like, what this ecosystem should look like. So being able to bring those partners on board, to be able to interact with them and create synergies, I believe is actually a very unique opportunity for all of us to grow and to learn from each other, and hopefully avoid mistakes we've made in the past with past technologies. Yeah.
So what's your ideal state then, with all of the different initiatives that you're part of? What would be sort of like the perfect outcome, let's say by 2025, so next year, where you go, yes, we have succeeded and we're going to continue to grow, but we've met some milestones. So what would put a smile on your face and you're thinking, yes, we're well on our way for 2025 with each one of the initiatives? What's the gap? What's the ask to the broader audience to take you there? And then what does that future world look like for each of the projects you're working on?
That's a major question. So for HealthAI, it's pretty simple. We have a very clear implementation plan. And by the end of 2025, we will most probably already have at least 10 countries identified as what we call pioneer countries, to whom we will be providing training 6. So we're aiming to be able to reach that point so that in 2026, those countries start validating tools and be certified by HealthAI. And out of those 10 countries, if around 75% are among low and middle income countries, that will contribute tremendously to our core mission, which is also in terms of ensuring equity when it comes to not only development, but also access of AI solutions for health that we believe have the potential to lead to better health outcomes. And so a lot of work ahead there, also building up our repository, which needs to be up and running by the end of next year. So if that's all done and well, you'll see a smile on my face for sure. At Unite, we're growing as a network of parliamentarians. We have our flagship event. We're doing it for the first time in partnership with the World Health Summit in Berlin in October. And so that's a very exciting moment, which means that if we're successful, we'll be doing a second edition at the end of 2025 with more and more parliamentarians. Unite is already 7 years old. I would like to see now that we've overcome 7 years, to see us more and more impacting in terms of concrete policy changes. As we've seen in many countries, like we saw, for example, in Ecuador, where parliamentarians of ours have pushed for a new mental health law, or in Argentina, where a lot of laws around digital health have been pushed forward, or even in Kenya, where we saw harm reduction drug policy legislation pass through with the support of the Unite peer-to-peer network. And so if we can have more and more cases of a positive impact that parliamentarians are having with the support of this peer-to-peer Unite network, that would certainly mean that we're moving in the right direction. And academically, the Center for the Global Health Policy Lab that I'm chairing in Berlin, we just hired our new executive director. I would love to see its main goal already starting to be accomplished, which is to have a repository of laws and policies in the field of health accessible to everyone, and hopefully starting to see the application of large language models to allow us benefiting from that wealth of knowledge, along with my academic work in Lisbon, where we're focusing on a lot of modeling of health impact of policies. So it's all interconnected at the end of the day, and all hopefully leading to better health outcomes and focusing on ensuring that those that are most marginalized and most vulnerable are not left behind. As I said, that's very core to everything I attempt to do.
And I guess the ask to the audience is get involved, right? So all of these are pretty much open platforms, right? Where people can volunteer, maybe not for the parliamentarians. Maybe you have to be a parliamentarian to be part of Unite, but it sounds like the other programs, people can volunteer and say, I have got some expertise, I'd love to contribute to your programs. Or are they open platforms basically? And then I guess funders, whether they're corporations or foundations, family offices, associations of investors or CEOs, they could say, you know what, we want to contribute. We want to devote some of our CSR, corporate CSR, to what you're doing. And the reason I bring this up is I'm speaking at the CTA Institute in just a few days, and we have over 400 CEOs attending. It's a private conference, but it's focused solely on CSR. Like, where can we apply our corporate CSR energy and our dollars towards particular programs? And it's very action focused. So in the conference, there's only two speaking portions, and then the rest are roundtables to take it to action. And excuse me, I happen to be in one of the speaking sessions. There's one that's almost like a fireside that's global, and I'm with David Rhew, that's Chief Medical Officer of Microsoft, and then they have one with local CEOs, and then the rest are just roundtables into action. But it sounds like it's something I could bring forward in a few days about what you're doing and say, hey, can they provide corporate sponsorship, for example, for the different programs? So I guess the question, you're looking for funders, you're looking for people to volunteer, right? Across all of the platforms, or would the Unite just be for parliamentarians?
Well, Stephen, we'd be happy to have you an ambassador on all fronts. So thank you for offering. And yes, we do depend, all of my work in every field is nonprofit. So it does depend on generous support from partners. HealthAI does have a business model that wants to become partially self-sustaining in the midterm, but for now, to get us where we need to as a global community, for those that believe that artificial intelligence has this transformative capacity and that it needs to be used responsibly, especially in the field of health, we are very open to partnerships. And yes, of course, support as a nonprofit is very much welcome. So please send your people you meet who show interest our way. We would be happy to present our strategy in further detail. Unite, yes, is a network of current and former legislators, and there's a lot of ways to help there by saying that either people who know good current or former legislators that they think should be part of our network, that's already a great way to help. And as a nonprofit, if you believe that this is a mission worth investing in, please do reach out to us. As I said, we're organizing our global summit in October. That's a great opportunity for engagement. And on the academic front, as always, we do depend on the support of those that provide us financial support so that we can continue our research. One last note, if I may, not on a financial note, but on a partnerships note, and going back to HealthAI, anyone who would like to be part of the global conversation when it comes to artificial intelligence in health, as long as they can represent an institution, we just don't accept individual applications. But if you can represent an institution, you can apply to the HealthAI community of practice, which is a unique, it has no financial burden, and it's a unique community where you will be hopefully able to convey not only your thoughts on the role of artificial intelligence regulations and AI, and how to use AI responsibly in the field of health, but also an opportunity to hear what the global discussion is and to be part of that conversation. And to apply is very easy. It's if you go to our website at healthai.agency, you will find the link to our community of practice application form, and we'll be looking through those applications throughout the summer. So it's a great time for anyone representing any institution, be it from community-based organizations, academia, but also technology companies, private sector, governments, regulators. The door is really open to create a global community of practice focusing on AI and health, with a particular focus on the responsible use of AI in regulations.
So when you're saying institutions, you're saying NGOs, organizations, formal organizations, and then participants are representatives of those different organizations, and you would include in their corporations as well, right? Good.
Absolutely. Yes. And the good thing about the application process is that, for example, especially multinational companies are so big, we've decided to allow application of departments or divisions within a company. So a major company that has one division that focuses exclusively on ethics and regulatory, but there's another division that is also interested that focuses more on engineering and machine learning, but would also like to be part of that conversation, both can apply. And so we try to make it as open as possible.
I mean, somebody like the Satel Institute, I could bring it up at this conference with the Satel Institute. Maybe they'd be interested in contributing in some way. Or WITSA. I'm embedded in this sort of program with WITSA, this World IT or World Innovation Technology Systems Alliance. It's the largest industry association of associations, right? So maybe, it's easy to bring it to them. In fact, I'm interviewing their CEO this week. So I'll bring it up. I could bring it up within the YPO community, which is the CEO communities. There's a Leaders on Purpose, which is a multinational CEO community. I'm just thinking, sort of brainstorming with you. On your Unite, do you have like an advisory board so you get private industry being able to, give their insights into what the parliamentarians are doing or not?
So from our foundation, we made a very conscious decision of not accepting any funding from pharmaceutical companies because we wanted to avoid discussions around potential conflict of interest, since we work directly and represent directly parliamentarians, people who are in office. But we are happy to engage with everyone. And beyond the pharmaceutical industry, we do engage with other partners, although most of our funding comes from philanthropic organizations, but we are completely open to corporate social responsibility support and other forms of collaboration. And so if people see interest in promoting science-based policy making at a global scale for the betterment of health, we to do so, I would say. And there are other parliamentary networks out there, but with a focus on global health, we, I believe, are very uniquely positioned. And our partnership with the World Health Organization has provided us with a positioning that has helped us move the agenda forward. And we've been highly engaged in multiple, we've had a seat in basically every high-level meeting at the UN General Assemblies. We've we have a permanent observer status at the Interparliamentarian Union, and we continue working very hard with parliaments around the world pushing the agenda forward. And so we would be very, very keen and happy to find new partners to support us to move this nonprofit mission forward.
So let me kind of summarize what I'm hearing then. I'm hearing that you at a very young age, you had this interest in healthcare, especially, and you trained as a doctor, and you even practiced for many years, and completed a 5-year infectious disease residency, did an internship at the WHO, the World Health Organization, and so you're really incentivized, and you're sort of a catalyst, self-catalyst for your interest in healthcare, including becoming a doctor. That led you to then serving in Parliament for 4 terms in Portugal on health and foreign affairs, and you were, in addition, a city councillor in the city and deputy mayor as well in Cascais. And excuse me, that sort of continual sort of passion for healthcare, even during COVID, you volunteered as a medical doctor in the emergency room, and but concurrent to that, that got you interested in creating this healthcare AI initiative, which is sort of like a certification body for regulators and what they're doing in terms of AI, right? So it's a way of.
Oh, honestly, yeah, just to say that I did create it. I was recruited for the role of CEO. It was actually founded in 2019 initially, and the first CEO was Amandeep Gill, who then left the organization in May 2022 to become the tech envoy of the United Nations, and he actually put together the UN high-level advisory body for AI, which you certainly have heard of in New York, and we're part of its network of experts. And a global recruitment firm then reached out to me, and I ended up being chosen for the role of CEO. So yeah, in that case, I wasn't the founder, but I'm happy to be part of the team at this point. Yes.
So, but because of your parliamentarian work, you're the founder and president of Unite, this parliamentarians network for global health. And you're also part of the AI for Good global impact or global initiative for healthcare and AI, which has the support of the ITU, the World Health Organization, and World IT Organization. And with all of these, you're embracing participation, particularly from the institutional side, from corporations or NGOs or other kinds of work. It could be your academic organizations. And you're also open for people who are willing to provide funding support as you scale these programs. And corporate CSRs would be ideal, for example, right? Because it'd be a very close match between them. Corporations wanted to do have social responsibility, and all of the programs you are working on have that social responsibility arm. But CEOs that are out there, family foundations, including institutional kind of foundations as well. I mean, really, it's an open platform for people you want to bring into really population health and ensuring that it's inclusive and you're providing meaningful impact, right, in terms of healthcare globally. Is there anything else you want to add to that?
No, Stephen, you graciously have summarized it, and I appreciate that. And all of that support is very much welcome because we are living in a challenging time geopolitically. Funding streams are harder to reach out to. So those believing that these missions are noteworthy of support, this is really the moment to step up. We need to continue moving forward when it comes to ensuring health for all. And on the AI side, if I also may say, for those interested in supporting health AI, yes, from a CSR perspective, it makes a lot of sense. But even from a corporate strategy perspective, making sure that we are creating an ecosystem that fosters innovation, that creates new markets, that is actually fostering technology to reach people, to have impact in health systems and citizens, well, I would say that should be part of any business plan of people working in this space. And so this is an opportunity also to accelerate the agenda and to make sure that those developing technology are able to reach the markets and reach the people and reach the end users and make sure that they have adoption on the ground.
So Ricardo, you're such a great ambassador for all of the programs that you are involved with. And more than an ambassador, you're leading these programs in a leadership role. And I can see people engaging with you and ensuring that you meet your milestones. And we should do a post 2025 interview, and you'll be smiles because you'll know that you're well on your way. Is there any last recommendation you want to leave to the audience, and that, maybe call to action or something else, but we've been doing that throughout the interview. So anything else you want to add?
Well, I think that it has been demonstrated that, and I'll make this as a generic remark to end, if I may, where we're looking at health systems, particularly in the richer countries of the world, that are completely broken. They're focused on disease. They are reacting to disease. And that is putting such a tremendous burden on our economies. More and more money is being pumped into health systems that have been transformed into black holes, not getting any outcomes. Actually, we're putting more money, and we're seeing at the same time a rise of the burden of disease. So now with the rise of technologies, I think, and particularly with AI, it's a unique opportunity. Instead of us trying to retrofit AI into health systems, let's use the advent of this new technology to forward think and rethink completely how we can deliver better care. How can we make the population healthier? How can we create societies that are more focused on health and well-being and less on disease? And that depends on policy, that depends on technology, that depends on leadership. And through all of the different initiatives that we talked about today, but many others that are out there, and a lot of people are working in this space, it's a unique opportunity, I would say, because AI in particular can either be the greatest divider of our time, social, economic inequities, but at the same time, if we get it right, if we get the regulations right, if we get the ecosystem right, we can actually use this moment with the advent of this new technology to actually make AI the greatest equalizer of our time and make sure that those that systematically have been left behind can leapfrog to the future, and that making sure that people, even in low and middle income countries, can aspire to have healthy, productive lives, which at the end, ultimately is at our reach. And so those that have the responsibility of leading organizations in these ages, and those that have the opportunity to be able to invest in these kind of initiatives, I would call on you to do now, because the moment is ripe for change, and we need true leaders to step up if we want change to happen. Because what we are seeing is a shift towards more and more national focus, people not understanding that if we do not work together, this will lead to worse outcomes for all, including those that are in richer countries that are thinking that they are protecting themselves with a more nationalistic approach. We need to focus on working together at a global stage and doing so in a way that we learn from lessons past, where in the past we have left a lot of people behind. We have let, especially people in low and middle income countries, feel that the global north wants to take over the decisions for the global south. We need to work in a collaborative way, and hopefully bringing a bit more human, compassionate approach to care. If we're able to do that, maybe that humanization of healthcare can then sprinkle on to the rest of society.
Absolutely. So, and a great way to do that is support all the programs you have, right? Like the HealthAI, your Unite, your Parliamentarians Network for Global Health, your Global Initiative for AI in Healthcare, and much more. And it just occurred to me, are you working with the World Food Program and the Innovation Accelerator? Because healthcare is a big part of what they're doing as well.
No, actually, no, not yet. But I guess that's another piece of homework for you to help us connect.
Yeah, I mean, happy to do introductions post-interview, so because I'm embedded in all the different programs. You know what, Ricardo, it was a long time that we're connected, and glad we did this interview. You're doing amazing work, and I really encourage my audience to support everything you're doing. And I can see you now being the president of a country, or maybe the UN at some point, or because you're very execution focused, right? Very action focused. So
it's very kind of you. But right now, I think we need to focus on, maybe just to let you know this, Stephen. Sometimes, a lot of times people ask, like they ask anyone, where do you see yourself 5 or 10 years from now? Every time I made plans that long, they always failed. So I've decided to change my mantra. And so every time life gives me an opportunity, as I have now here at HealthAI or at Unite, it's doing my best to get the most out of it and contribute as much as I can through that opportunity. And what I've learned is when you do that, amazing opportunities open up in the future. So yeah, it allows you to stay optimistic, but also open to surprises what life can bring next. And I think that's an exciting way to live. And I really appreciate you. It means a lot. And we're very grateful for your support.
Well, thank you again for taking the time to share so much of what you're doing today. And again, I encourage the audience to do everything they can to support it when you do. So thank you again.
Thank you.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.